Anthony. Dr. Anthony is founder and CEO of Enlumen, which is a consulting company that works with food, nutrition, and health technology companies to help them compete in the personalized nutrition and health marketplace. Dr. Anthony?
Thank you so much, Robin. It's so nice to be here today and talk about some of the challenges of implementing personalized and precision nutrition. As you mentioned, Enlumen is a consulting company, and our clients include select registrants at this conference. But I want to underscore that the opinions expressed here are my own, and they do not express the views or opinions of any current or past clients or employers. So as Marian Abrams shared yesterday, the personalized nutrition market is large and growing rapidly. The size estimates range from about 2 billion to about 20 billion, depending on what is included in that estimate. And annual growth rates are forecasted to be between 8 and 14% over the next decade. So given its size and growth, it's really not very surprising that a variety of different providers are rushing to understand how they can fit into this personalized nutrition ecosystem. However, when seeking to implement personalized nutrition, one of the biggest mistakes I see so many companies make is they look to put themselves and their brand at the center of this ecosystem. And I think that's a big problem. If you could hit the animation, please. It's critical to start with the consumer, understanding their needs, behaviors, and values. And really, for my talk today, I want to spend some time focusing on the personalized nutrition consumer and sharing some insights about the people that are looking to more personalized solutions to manage their health and wellness. Next slide, please. It is clear, and we've heard this over the last few days, that more and more people are seeking more personalized approaches to manage their health through food. However, there are widely different views about what health means. This is due in part to individuals having different needs, but it's also based off of information or misinformation access, driven by our omnipresent connection to the internet. Many people are turning away from experts, unfortunately, and they're citing scientific controversy and instead seeking self-affirming information or groups that align to their beliefs. This has led to many health and well-being consumers turning to what I refer to here as tribes or benefits. You could think about this as kind of subjective personalization. This is more around different eating styles or dietary patterns like keto or intermittent fasting or flexitarian. These consumers often move between these eating styles for different benefits. They may be low carbing for a few weeks to try and lose weight, and then moving off of that, but staying away from wheat because they believe it causes brain fog. They may be looking to bring more fruits and vegetables in their diet to support heart health, and at the same time consuming more meat snacks to build muscle. Ultimately, this ends up leaving people in a lot of frustration and constant switching. But what we are seeing in a small amount of consumers, and I want to kind of underscore the comments that were made earlier, it's not everybody. But let's say in about 10% of health and well-being conscious consumers, they're seeking a more technology and data-based approach to personalization. This is objective personalization. The challenge here is oftentimes that while they're using online tools and wearables to help to tailor their diet and their lifestyle, oftentimes what they're expecting out of these programs is far ahead of where the science is. Next slide, please. So let me talk a little bit about consumers' expectations versus where the science is. So this is some actual consumer research and some real feedback that I had received when I was working before with a previous company, Advanced. So expectations range from things that are well studied and more closely related to chronic lifestyle disease, like overweight or heart health, to other areas, next advancement please, that are kind of emerging consumer areas that kind of walk in that line that's sort of between sort of health and well-being. Wondering about things like joint health or joint pain, or things like digestive health. And then finally, next, it can go to in the moment types of performance benefits. Things like managing stress in the afternoon, or maintaining sustained energy. Next slide. So with all these differences in expectations, is there an ideal personalized nutrition consumer? Well, I think that there are some commonalities that emerge. They are highly motivated and goal-oriented. They're digitally savvy data trackers who are seeking objective advice based on personalized data. They have to be willing and able to follow prescriptive lifestyle advice and be prepared to manage and act on that information. Overall, they're generally higher education and higher SES. Animation, please. So overall, they are relatively wealthy and relatively healthy. And this really poses an interesting challenge when we consider the importance of access to personalized nutrition, not only for the well-educated and well-off and relatively healthy person, but also for lower socioeconomic status and disadvantaged minorities who suffer disproportionately from chronic lifestyle disease. So for this reason, we wanted to create a model of personalized nutrition that would support creating and sustaining engagement with a wide variety of potential users. And that model is shown here. So as part of an IFIN's task force on personalized nutrition, we published this model as part of a perspective paper on guardrails for the implementation of personalized nutrition last year. To be able to sustain benefits over time, you really need an evidence-based model that allows for continued customer engagement over time to optimize health. So this model breaks out as follows. I think it's important to really define what benefit that you're looking to go after and what is it that you're trying to improve. There should be a measure that is an objective and credible measure or measures of that health and function that should lead to information, personalized recommendations to improve health and lifestyle, and then that should drive behavior change. So I think that Christina did a really nice job talking about this, is that behavior change means that the person has to be empowered and willing to act on information. And that can be a real challenge depending on which person you're going to be working with or which consumer that you're targeting. A systems-based approach should be adopted that supports reassessment and new advice as health state or goals change, meaning that as you achieve or realize a change in health or function, those measures change, that information changes, the behavior changes, and ideally the outcome changes. So it's a series of virtuous cycles that ultimately can help to drive longer-term health. Next slide, please. So I think there's a lot to unpack in that model, and I want to kind of share some lessons learned in my own experience being a co-founder, launching, and ultimately selling a personalized nutrition company, as well as currently working in the field with a variety of clients. I think a lot of companies fall down because they want to be wellness. They want to be all things to all people. I think that's a mistake. Don't try and meet all consumer needs. Start focused on a specific health outcome or benefit. I think this allows you to identify where your program or technology can best deliver against one or more user need gaps. And let me pause on that need gap for just a second, because the best needs to be going after is there something that is a health or functional need for that user? And is it something that is not being met? That your technology, or program may be able to serve or work in a unique niche to help to meet that person's health requirements. And as I said, user expectations are often ahead of science. So focusing on proof points of your program can differentiate your product and service over time. And I want to talk a little bit more about the state of the science and what's needed to get there in a few slides. Next slide, please. Measures of health or function. There's a lot of good discussion earlier about, what is it ultimately going to take in terms of proof points for the technology. But when we talked about this as part of our IFIN's task force, we talked about the importance of making sure that it's appropriate and validated methods and measures. And a few days ago, there was a discussion about this isn't just about biology, but it's about behavior and sociological measures. It's extremely important to make sure that for your consumer that you are targeting or you're communicating instructions clearly. User understanding will definitely impact data quality and accuracy. Many of these tests are done at home. And I can't tell you the times that I've seen pictures of things like blood spot tests where people will literally put the blood outside of the spot. Anything that you can imagine could go wrong does. And so communication is critical. You have to be clear about how the data will be used. I will say, like, transparent about how the data will be used. Really, measures should be included when there is evidence for a related benefit. Now, I'm not saying that you can't be looking to collect additional data or consider collecting additional data for research purposes, but I think that you should be extremely clear with users how, and transparent about how this is going to be used. There has really been a flashlight shined on data and data use in the last few years. Don't be anchored in any one technology. I see some personalized programs trying to sell a technology. You could have two challenges here. One of which that the use of that technology may be limited because it's simply not measuring enough to get a robust picture. The second thing is you're always at risk of the rug being pulled out from underneath you for the next great thing. So be validated, diagnostic, agnostic, and don't go straight to blood, sweat, and tears. Make it easy with fast feedback. And let me give an example of the problem statement here. Next slide. So it's basically inputs need to match outputs, right? The benefit combined with the measures is the inputs, the information combined with the behavior change is the outputs. But this is what I see too often. Animation. A consumer may be spending hundreds, if not thousands of dollars to become part of a program or subscription. They then provide, next few animations, please, a DNA test. It could be hours of filling out online surveys, blood samples, microbiome samples, and in addition to that, next one, they could be waiting weeks, if not months, to get back, final animation, please, that they should consume more fruits and vegetables, take a vitamin D supplement, and consume more salmon or fish oil. This simply doesn't match up. So we really have to look, next slide, please. When we're providing information, the inputs and outputs have to match up. And of course, those outputs and recommendations must be communicated consistent with the user's skill and experience. If that information is not communicated in a way that the recipient understands their data, how will that drive changes in behavior? And communicate consistently with applicable guidelines and regulations. Two reasons for this. I think guidelines and regulations give enough flexibility to be able to communicate responsibly, but it's also an anchor point, a familiar point for the user that will help them to remember those recommendations and how they fit into an existing context. Next slide, please. Finally, enabling behavior changes. Make sure the user's needs and preferences are acknowledged and respected. If somebody comes into a personalized program, they're hardcore keto, you're not going to tell them or effectively to be able to follow a plant-based diet. They'll then be more open to some objective and appropriate nudges. Look for opportunities to provide feedback and reason to believe through small, frequent interactions. The type and frequency of feedback itself needs to be personalized to the user. And the final thing here is that I thought that Sean from Amanda did a wonderful job talking about there still needs to be a real person behind it. What I've seen time and time again in these programs is that having an RD on the other side that can help to manage some of those communications is so critical. Next slide. So let me just talk a little bit about where we are in the state of science of personalization. And I think that this is a miss for a lot of companies because I think that if you really think about science and doing it well, it can become a point of sustainable differentiation for your program. The reality of it is most companies do not have published data to support their program and its output. So let me talk a little bit about where we're at. Right now, I see a lot of people out there, they're saying our study, our program is supported by 10,000 different studies, but it's all research done by others. What's starting to emerge more now is the ability to measure individual differences. But as we talked about before, a biomarker isn't necessarily an outcome. Next one. For personalized nutrition to be successful, ultimately the program has to deliver on health and functional benefits. Next slide, next one. It has to be better than one-size-fits-all approaches. And the final one, and that program has to sustain or improve benefits. Remember, I said that cycle has to be continuous over time. And the reality of it is we're just getting here. I think that most of the programs, that are more advanced in science are just at the point where they are delivering or starting to show some health and functional benefits. So there is more research to be done. But I do think that what happens if you're doing this well, it also becomes some of the IP of your program. And as we also heard in the last few days, users are looking to understand which programs are being responsible in building the science. So I do see it as an important opportunity. So last slide. Key takeaways, some simple do's and don'ts if you're thinking about implementation of this. Identify your consumer pool, a clear and compelling user need gap. Don't start with a technology push. Technology should be in service to the benefit. Build an engagement cycle around your consumer and her user experience. Don't let your inputs be much greater than your outputs. And continue to develop proof points of your program. Don't just rely on secondary sources for support. Your consumers are going to be looking for it, and your program will be stronger in the long run. Last slide. Thanks so much for your time, and I look forward to the discussion.
Great. Thank you so much, Josh.